Thank you for not sharing the embarrassing moments of our wine tour, but thank you for the introduction. I'm David Goodman Meza. I'm a senior research associate at the Kirby Institute, and I thank you guys for the invitation to be here. This work was done in collaboration with colleagues both in the United States and in Mexico, and I'd really like to acknowledge the work of Raul Bejarano, who led really this work, and if anybody has big budgets and is looking for a postdoc, he's in look for work, so please let me know and I can let him know. So before we begin, I'd like to acknowledge the traditional custodians of the land on which this work was performed and where we meet, and I'd like to pay respect to elders past and present. I'd also like to acknowledge the Kumeyaay people as the traditional custodians of the land, now known as Tijuana, where I'm from and where a lot of this work was actually done. And to thank a couple of harm reduction partners in Tijuana and Mexicali, Provencaza and Verter, for their leadership in this space. As a US citizen, I would also like to protest the current gutting of science by the US federal government. I have no disclosures. Thank you for that. So we know people use drugs in Mexico, although with much lower prevalence than in our northern neighbors, such as the United States and Canada. National surveys show lifetime drug use really remains moderate overall, with cannabis and cocaine most commonly reported, although the prevalence of methamphetamine use has been ever increasing, and I don't think it's really well captured on this graph, probably due to the methodology with which this is captured. One notable absence on this slide is really you don't see opioids, right? And it's just really not heavily reported amongst the population in Mexico nationally, despite Mexico being known as a hub for both production and transportation of heroin and now fentanyl. However, certain pockets, especially along the northern border with the United States, show higher opioid use. Border cities such as Tijuana, Mexicali, and Ciudad Juarez are known centers for heroin use, and this we know through years of research and surveillance efforts. And so while opioids seem rare nationally, they have traditionally been present in these key regions. And we also know that fentanyl is used in Mexico. My group, we reported on fentanyl use and overdoses in the city of Mexicali during the pandemic through Mexicali's safe consumption site. And studies have also documented the presence of fentanyl through wastewater analyses. And despite this knowledge, policy in the country has been really inconsistent. During several years of the prior presidency, official policy was actually that fentanyl was not produced in Mexico and fentanyl was not used in the country. And it took nearly 5 years in office for the president to acknowledge the production of fentanyl in Mexico. During this presidency, methadone production was halted, bills to declassify naloxone were shelved, and then funding for NGOs was also halted, so really hit the harm reduction agencies really hard. However, recent official reports have now acknowledged fentanyl use and its harm in the country. So where are the overdoses? When we look at official data, drug-related deaths appear almost non-existent compared with our northern neighbors in Canada and the United States. For a country of 125 million people that we know people use drugs, 235 deaths in 1 year seem to be very little. So this raised the key question for us, are overdoses being missed because of how deaths are coded or investigated in the country? And so just a little reminder of how overdose deaths would get into the national statistics, right? When a person dies, their case is either handled by their treating physician or referred to the medical examiner, which in the country is known as CEMEFO, given that little image. That examiner or physician will file a death certificate listing the immediate and underlying causes of deaths. Those death certificates are then compiled and coded into national mortality databases, which become the basis for our statistics, right? But really, here's the issue, right? If toxicology isn't performed or if the examiner doesn't list substance involvement, the death is recorded under a general medical cause. So by the time it reaches the national statistics, the overdose is essentially invisible. So we had a hypothesis that many overdoses in Mexico have been systematically miscoded using non-specific ICD codes, leading to an underreporting of overdose deaths in the country. So really, how could we prove this and make it into data and make it into a paper and really create advocacy around this problem. So we had really two aims, which one was to figure out which were these proxy codes used by medical examiners that are being used in lieu of overdose deaths, and then to use these codes to calculate drug-related mortality rates, both nationally and at key metropolitan levels. So for aim one, we submitted freedom of information requests to all 32 states. We requested data from autopsy where postmortem toxicology analyses were performed, and then asked for all these different variables. For aim two, we relied on official Mexican mortality data. It's really cool in the country. They have a de-identified individual level database for every year of every death that occurs, and that can be downloaded pretty openly. And then we also access population level data from INEGI based on 5-year age groups. So for aim one in our statistical analyses, we classified deaths as substance use related if toxicology was positive for opiates, cocaine, methamphetamine, or benzodiazepines. We excluded trauma, hemorrhage, and infection. And then we compared cause of death between substance-related and non-related cases using Fisher's exact test and including those causes of deaths which were statistically significant as our proxy codes for the further analyses. While we calculated deaths, this occurred between the years of 2005 and 2019 for strategic reasons that we can discuss later. And we also only calculated rates for people between 20 and 39 years of age. Crude rates were determined by aggregating number of deaths by year in metropolitan area, divided by the population age between 20 and 39, using both the standard ICD codes and then the proxy-related codes that we used in AIM 1. And then we did national comparisons between the United States and then 4 countries in Latin America, which had have a similar GDP to Mexico, and then that had actually the data that we needed to do these analyses. So a bit of convenience. So into the results. Of the 32 states in Mexico, 7 provided the data that we needed for our analyses. Baja California, Sonora, Coahuila, Zacatecas, Mexico City, Oaxaca, and Yucatan, where the majority of death data came from Ciudad de Mexico and Baja California. And we would expect that Ciudad de Mexico, because it's such a large metropolis with close to 30 million people, right? And then Baja California, because this is where we know where most of substance use occurs and where many deaths occur. And so the deaths where the causes of deaths with positive toxicology were acute pulmonary edema, acute myocardial infarction, and then acute respiratory failure. So these were the different causes of deaths that then we mapped to their respective ICD code that we used as our proxy codes to estimate our mortality. So here we see the yearly drug-related death rate using standard ICD codes, and I'm pretty sure you've seen a similar chart in many news sources or in these conferences. And what we see here is really the increased rate for the United States in this pink color, and we see how it increases exponentially with the introduction of fentanyl around 2013. We also see that for all of the Latin America countries, including Mexico, the overdose rate is nearly 0. Now, when we see our derived proxy code estimates, the pattern for Mexico really changes dramatically, and it shows this clear upward trend, and it's particularly in that last decade, which, if you look at the left panel, it really mirrors that of the United States, albeit at a much lower rate, which is kind of what we would expect given the magnitude of drug use in Mexico compared to the United States. Interestingly, for the other Latin American countries, there is also an increase in the rates, but we don't see this kind of exponential increase as of 2013 because we really don't expect fentanyl to be in these other countries. At the metropolitan level, using these standard codes, we see little to no change in the overdose rates from 2005 to 2019. The colors are really similar between the two maps. The only exception is really Chihuahua, which is in a circle or squared in that red box. And this appears to be the only municipality that's consistently coding correctly their overdose deaths. When we use the proxy codes, we see things much more similar to what we'd expect, with the higher overdose rates in cities along the U.S.-Mexico border, such as Tijuana, Mexicali, Reynosa, Laredo, and then other cities like Hermosillo. Some interesting ones that are interesting because they're quite unexpected were cities like Cuernavaca, Toluca, and Culiacan. So many limitations, of course. There's a lot of hand-waviness in this analysis. It's really impossible for us to estimate with true precision the true magnitude of drug-related deaths in Mexico without exhuming all of these bodies, right, and doing toxicology at this point, which is obviously unfeasible and unrealistic. One thing we didn't analyze, right, were deaths amongst people over the age of 40, where these medical causes of deaths would be much more likely. So we don't really have estimates for these age groups. We limited our analyses to 2019 really strategically because as of 2020, COVID-19 becomes an issue, and a lot of the acute respiratory failure deaths might have been coded due to this disease and not really overdoses. And then the data that we obtained from the Freedom of Information Act was limited to a small number of states, so we, of course, have to question our generalizability. So in the last 40 seconds, it's really likely that an overdose epidemic in Mexico has been hidden due to miscoding of deaths, although exactly by how much is quite impossible for me to say. Reasons for this miscoding are really many. Of course, limited toxicology capacity. Many forensic centers lack the equipment, reagents, or personnel to be performing these kinds of tests. Incomplete reporting. When they have the toxicology test, they might not necessarily report it as substance use related because they state that they don't have the actual quantitative levels to say this. There might be stigma and legal concerns which might downplay or omit due to social or judicial repercussions. Mexico, of course, is a country that is suffering from other drug-related harms really due to the violence, and so there's a backlog of death investigations. And then a real lack of national standards. I'm gonna, in interest of time, I'm gonna skip my public health recommendations, and then here's my email if anybody wants to reach out or have a coffee or have a glass of wine. Always happy to.